16-year-old boy underwent splenectomy for immune thrombocytopenic purpura. During the procedure, the surgeon noticed bleeding while separating spleen from the stomach. Which vessel is most likely involved in this bleeding? So to answer this question, we need to understand the peritoneal attachments of spleen and surroundings of spleen. This is stomach, spleen, left kidney, transverse colon, splenic flexure, and diaphragm. From stomach to spleen, we have gastrosplenic ligament. From left kidney to spleen, we have splenorenal ligament. From diaphragm to spleen, we have phrenicosplenic ligament. From spleen to colon, we have splenocolic ligament. From diaphragm to colon, we have phrenicocolic ligament. So why do you need to know all these peritoneal attachments? Because when you are proceeding with splenectomy, you need to take down all these peritoneal attachments that are related to the spleen. Out of all these ligaments, we give utmost importance to gastrosplenic ligament and splenorenal ligament, because these two ligaments contains blood vessels within them. You need to take down all these peritoneal attachments that are related to the spleen, then you can safely take down the spleen. Gastrosplenic ligament contains short gastric arteries and left gastroepiploic artery. Splenorenal ligament contains splenic artery and tail of pancreas. This is midline, this is anterior, posterior. Stomach, lateral and posterior to stomach, we have spleen. Posterior to spleen, we have left kidney. Everything that is drawn in yellow is our peritoneal reflection. Left kidney is totally retroperitoneal. So the first peritoneal reflection that we can notice here is our splenorenal ligament, which contains tail of pancreas and splenic artery, which is riding on top of the tail of pancreas, and it is going to supply spleen. Another peritoneal reflection that you can notice here is our gastrosplenic ligament, which contains short gastric artery that is going to supply fundus of the stomach. It is very evident now, when you take down these two ligaments, you have to be really careful, because these ligament contains splenic artery and short gastric artery. So this is a cross-sectional image, same concept from a different perspective. Anterior, posterior, vertebra, right kidney, left kidney, spleen, stomach, aorta, celiac trunk. So left kidney is totally retroperitoneal. The first peritoneal reflection that you can notice is our splenorenal ligament that contains splenic artery. Another peritoneal reflection you can notice here is our gastrosplenic ligament, which contains short gastric artery. Here the surgeon is separating spleen from the stomach, meaning is taking down the attachment between stomach and the spleen, and the artery which is present here is our short gastric vessel.